director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, well, it's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, and with great anticipation, I've been looking forward to today. I've been talking about my relationship with a new company emerging. I believe is space age. It's new age. No other device or testing equipment that I've been around, and I've been around quite a bit, matches the ability of what we're going to be learning about today. I'm so happy to bring it to you. Something, well, I don't actually like the name. That's what they call it. Call it MCG. Now, they mean it to be interpreted as multifunctional cardiogram. And I understand the nomenclature used to describe it prior was even worse. But the heck with the name. That's what they call it. You're going to learn today about how it is that this may be, well, I'm sure it is going to be the most space-age device introduced to you in a long time. It is now available here. Well, it's available here in Western Pennsylvania here. It's also available here in my office here. We had just gone through a run of about 13 patients last Thursday. We're going to be talking about the MCG. I guess the way I've phrased it, and we're here to find out how accurate that term would be. Getting a cardiac catheterization of the information of a cardiac cath without ever getting a cardiac cath. Is that possible? You think that's possible? Lying on a bed? Well, that's what the MCG promises to bring. We're going to be talking about this unique technology through its only representative. Only one company makes a device. There's only one representative here in Western Pennsylvania. He's a pretty busy guy. He's taken the time to spend our morning with us today. His name is Jere Singleton. And in the course of our discussion with Jere today, as well as next Friday, in what's to be entitled our full launch with the company, we're all focusing toward the 24th of February, where we're inviting you, the public, to come on in and, hey, take a test ride yourself. This test is available as a item in my office starting on the 24th of February. You don't have to be a prior patient. This is insurance covered. We'll be getting on more and more of this data, but geez, to find out what the status of your coronary vessels are without any invasiveness, could that be possible? Well, the MCG, what we talk about today, will hopefully clarify that point for you. It is the newest technology around. Now, in the course of our discussion with Mr. Singleton, you want to call in to ask a question and make a comment. The number, as always, will be 412-825-6262. That's 412-825-6262. MCG, okay, multifunctional cardiogram. What a function it does perform. Now let's take a look at our calendar as the month continues to move rapidly forward. On Monday, we returned with Roland. Now, we've been with Roland Thomas, representative of a company called BioAge, talking about bioengineered algae two times out now. We're going to have the trilogy be pulled to a conclusion on Monday, really getting down to the nitty-gritty of the actual supplementation, the different products that they have, the recommended dosaging of this stuff. This is some pretty potent stuff when you figure that it has been involved in correcting a lot of medical ills. Well, first in the animal population, and then since Chernobyl, quite a bit in the human population too. The story behind the awakening of the genius within has been intriguing. We'll bring it to a conclusion on Monday with Roland. Then on Wednesday, finally we get with Doug Inglesby, representative himself of the supplement industry. His family, very well known in the industry for years. Going to be talking about the flavor makers. I think it's a buzzword for how the pharmaceutical industry tries to entice you to take their drugs by making them taste so good, I guess. Anyway, more on that on the 16th. As I had previously mentioned, Jere, Mr. Jere Singleton, will be back with us next Friday also in a 1-2 punch, getting ready for that 24th here in the office. Once again, listen with great intent. If you have a desire to want to get this study done in no fuss, no muss fashion, as we describe it today, you can give us a call at 724-942-3002 and enroll to come on in and have it done on that day. Then the next week, starting on the 21st, I was just talking to Alan, who was in my office the other day. Alan Ridgway represents a company called Advanced Diabetic Solutions. We're going to be talking about his famous orthopedically designed, custom-made, mold-to-fitted shoes. I use all three of those words because I have a pair of those shoes. So does just about every diabetic in my office. Because to them, their insurance is covered. These are extremely comfortable, extremely expensive, and extremely fashionable. We'll be talking about that as well as a whole bunch of other implements used by a diabetic. If you are a diabetic, you want to be staying tuned to that show. If you know one, tell them about it. Tell them to listen up. They'll learn quite a bit and probably get a lot of free stuff by tuning in on that day. Then on the 23rd, a gentleman by the name of Kurt Domkowski is going to be our guest. He and Alan sort of team up in the diabetic world. Kurt has a unique product. I was just talking to a patient the other day who had a terrible wound. Turned out he got one drop of of hot water rolling off a coffee pot that literally burned right through her skin, just beneath the first knuckle on the right hand, and the skin just completely peeled away. And to you and I, maybe no big deal, but to a diabetic, that is panic. And what to do about it? Well, I think having RTD dressings, a case is going to be made for having RTD dressings in your medicine cabinet, maybe right alongside the Band-Aids that you already do have. Band-Aids are really a protective barrier. They don't do anything therapeutic to the wound itself. I think you're going to be finding out that RTD dressings, if I've heard it correctly, act sort of like a sponge and suck out the bacterium into the sponge, and then the sponge can be discarded. A unique concept. Let's find out if I have it right. And if I do, great. If I don't, Mr. Domkowski will straighten us out on the 23rd. And then, of course, as I've mentioned many times over, the 24th will be our day for you. The slots are closing. We got plenty of them left, but they have filled up. I'm looking forward to it. It's really a launch for the public. We already had our in-office launch. It was quite successful with the use of the MCG testing apparatus. So that's how it shapes up. So let's do this. Rather than waiting around, let's get off to the races and call Mr. Singleton right now. When we come back, let's see if we can bring you up to speed on where I think I am now on this new device. You won't hear about it anyplace else. No other place has it. They will be, folks. Believe you me, we're just ahead of the trend, ahead of the curve right now. Be back in a moment with Mr. Jere Singleton.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a blessing for your good health. Through the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on a Friday version of the show. Different for us, special guest today, and a special product to present to you with this brand spanking new technology that I think, it intrigued me from the moment I heard about it. Since then, we've had a chance to test trial it in the office. It has matched up to everything it was purported to be. I told you it was time to bring it and unveil it to you, and ultimately, as we have let you know about the 24th of this month, open it up to you, the public, to come on and enjoy this technology for yourself to see how it benefits you. Speaking of technologies, I was thinking the other day, my medical career spans a number of years now, and I think at the time that cardiovascular technology really took off, that's the same time my career was taking off. And so things like cardiac caths and something called, they call it PTCA, which stands for percutaneous transluminal coronary angiography. You didn't know that? Well, I had to learn that a long time ago. Angioplasty, bypass surgery, stents, cardiolite scans, stress tests, fast CTs, MRAs. Every one of these technologies has flourished, blossomed, and bloomed in the course of my medical career. A new technology now emerges, hopefully one that will take and put in its place those invasive technologies. The one we're going to be talking about today, through a representative of the company, the only company that's able to offer it to you. His name is Mr. Jere Singleton. He's with us on the board with us right now. Let's say good morning and welcome aboard, Jere. Thanks for coming aboard today.
Good morning, Dr. Courtney. I appreciate your invite.
Jere, we've known each other just so few days, but we've come to really enjoy each other's company in terms of sharing where we both come at. You're a rather young guy. Why don't you give us, because I always like to introduce the people I'm talking to on the radio to my listeners, what is your background, Jere? How is it you become involved with a company called ProLogic, now promoting one-of-a-kind technology? Little old you, Jere, what did you do to be put in a position such as this?
Well, again, I appreciate your invitation for the show today, and I think this is a wonderful topic, being that it's February and we have Heart Disease Awareness Month for us. But to give you a little bit of insight as far as my background, I'm nothing too special, but I have several years of medical device experience and different, all relating to cardiac care. And so when about 2 years ago I was introduced to ProLogic, and this technology was coming kind of on our forefront, and more research was looked into, and we finally decided that this is an excellent product, especially for this area and time that we're at, cardiac medicine. And so about 2 years ago, I began studying more and more about this product, clinical trials, and the patient benefits, and it was a no-brainer. So it's been a pleasure to work with this product, and typically my experience in medical sales is calling on physicians, and the process is very different with the product that I'm representing, and because when I share the benefits of the product and review the data and so forth, it's such a no-brainer. Physicians, patient, and in some cases it's a longer sales process. Working, trying to sell a physician on a product, drug therapy, and this has been one that's been received with great feedback. So it's been a great experience.
Now, the technologies I described a moment ago surely were earth-shattering. I'm talking about all that cardiac invasive stuff, with caths and angioplasties and the like, and they certainly they tore into the American medical community with such speed. I'm recalling it now, and it's amazing. The speed of all this has dropped off considerably, but I was there at a time when it was fever pitch. A new technology now emerges. I'm going to give you an opportunity to explain it because I'd never heard the term before, but the basis by which this MCG device operates is something called computational biology. This is brand new to me. I've never heard of it before. What is computational biology?
Well, that's a great question. Computational biology is really the meshing mathematics with science and medicine. That's really kind of a simplistic way to explain it. But really what you're doing in computational biology is you are building an empirical database of patient data over extended periods of time, over all demographics, sex, gender, and you're doing this and you're plotting different relationships between that data so that when you have this statistically valid database of patients, you're then able to, in a clinical environment, gather patients through a test or through the collection of data on an individual patient. You're able to collect that patient data input and extend it off for analysis and let it run through this empirical database of highly sophisticated calculus-related models that are able to give us, with a very high degree of certainty, that patient's risk or disease or their disease state. So it is a relatively new field of medicine, and it encompasses our technology and several others. The GNOME project is one of the most recognized examples of computational biology, but certainly ours is growing in its path, and I think with the vast advancement of computers and technology, I think we're going to begin to see more and more of devices and treatments that relate to computational biology.
Mathematics, huh? Equations. I never did like the thing, and turns out those that did really created a new niche, especially as we learn more about this particular device to see how it can literally, if not replace, certainly assist in learning information about the medical status of a patient through what? Mathematics? Come on, let's find out more about this. Now, this particular study is a non-invasive study. It is a non-stress study. It's a non-radiation study. It is a study that is a completely innocuous study. Could you stress that just a bit?
Absolutely. Like you said, it's a non-invasive. It's a resting test, rest-free, which typically, as you mentioned before, most of the diagnostic tests that are out there are invasive. radioactive isotopes. You're dealing with nuclear scans and so forth, or capitation, geography, and once again your basic means there, which are all phenomenal tests, and we're not at all trying to replace those, but we're trying to add another tool out there for our patients, for our physicians to evaluate their condition and work into a treatment plan that can help us, especially with corn. The main focus here for patients that are kind of scratching their head with this whole thing, what we're really looking at is coronary artery. And coronary artery disease is when the demand for blood flow around the heart. The heart has to supplement itself with oxygenated blood, which the oxygen comes from our lungs and then goes to the bloodstream. So that the heart needs a certain demand for oxygenated blood, and when the heart's not able to meet that demand, the supply for that demand, it begins to get what's called development of coronary artery, or reduced blood flow. We sometimes identify as acute. So typically when that's happening, this is how we identify it. Most commonly is with plaque, with the narrowing of those coronary arteries. The development of plaque from high LDL cholesterol or triglycerides and so forth. Those are the functions that narrow our arteries, make us at a high degree of risk for, say a heart attack or other cardiac conditions. So in the United States, it's been a growing epidemic, and the statistics say every 29 seconds, an American has a coronary event relating to those coronary arteries. Every minute of every day, someone dies from a coronary-related event. So now more than half of those who do die from coronary arteries present no symptoms, and 14 million people in the States have some level of. So this is a growing epidemic. We have over 1.5 million heart attacks a day. And fortunately, with medicine, and I'm going to include the CT in this, we're able to detect that presence early enough. We're able to treat it aggressively, but with therapies that would make it less invasive and less stress, would be stress-free rather. We're able to do so and prevent someone's, prevent a progression of heart disease that could eventually require a stent or a bypass surgery or some highly invasive surgery or whatnot or treatment. So for patients that are either at risk for coronary disease or have coronary disease, it's one of those things that you really have to take serious. You have to build a treatment plan and stay active with it. You have to be aware of what those risk factors are. And for those of you that aren't familiar with those risk factors, smoking, obesity, an inactive lifestyle, high blood pressure, diabetes, a high-fat diet, high in cholesterol or have high cholesterol, men over the age of 45 are at higher risk, women over 55, African Americans, excessive alcohol use. Really any family history. The biggest piece of the puzzle is genetics. So, and what the experts say is if you have some family history of heart complications, heart attack, coronary disease, you should really be a doctor even if you don't have symptoms. You should at least look into it because often a lot of patients, they don't seek treatment for coronary disease until major symptoms present themselves. And often they'll rationalize the symptoms as stress-related or heartburn or something less serious, and through years of not receiving treatment, they can develop something that is much harder for us to treat in the office, as I'm sure you're aware of, Dr. Courtney. So this institute, it offers us stress-free and non-invasive treatment for essentially to use it in effect as a screening tool, as long as you, again, present either some of the risk categories or certain symptoms, which covers just it's a very liberal ICD-9 list as I would refer to it, Dr. Courtney. So just about everybody can have one of these tests and should have one of these tests at least one time per year, because typically with patients, like I said, 50% of the time symptoms aren't presenting themselves, and you either have cancer history, or you're diabetic, or you have slightly high blood pressure or high cholesterol, or you're one of the risk factors that I talked about, smoking and so forth, and you might be concerned about some development of coronary disease. So it's a worthwhile test to have. It is reimbursed.
All right, we'll get to that in a minute. One minute too far down the stream, because I'm still back trying to formulate how this all got put together. I've noticed that as I looked at the literature that you gave to me, when this device was being tested, when it was going through its clinical trials, ultimately you make this claim, and I want you to explain it to both myself and my listeners. You say that this MCG was found to be 91% overall correct with its sensitivity, 83% with respect to specificity in detecting stenosis or arterial blockage. Now, I'm sure you mean with the coronary arteries. I just want to make sure that by taking this non-invasive test, you're lying on a bed. We'll get into the complete description of it, but bottom line is there's no invasiveness with this at all. You can be that specific and that sensitive with respect to these people and the coronary artery disease they may have?
Oh, absolutely. In what you described, we do have a sensitivity of 91% at finding food positive patients with coronary disease or their level of coronary disease. And we have an 85% specificity. If you want to look at it in terms of negative predictive value, we have a 92% negative predictive value. So the accuracy on this is far surpassing any other test of its kind, including invasive treatments like stress testing, which is around 65 or 70%, depending on how it performs. But to answer your question, absolutely. Now, the development of the machine, we've been working on this technology for well over 20 years. I believe 22 years now.
Yeah, that was going to be my next question. Take me back. Who came up with this idea?
Yeah, sure. It's the technology, the idea for this originally began with a doctor from China. His name is Dr. Shen. He was a barefoot doctor in China, actually at a very young age, and he ended up going to school in the United States many years ago, and became a cardiologist, practiced medicine for many years, and then about 22 years ago, while in practice, he was faced with some of the complications, like you indicated, being a high level of patients with coronary disease, like our area has a huge concentration, and no real good test, non-invasive test to screen patients for it and to screen them regularly for it. So that's really where the idea came from. Now he had also studied mathematics. He had studied a lot of mathematics and so forth. So the idea began with him 22 years ago, and of course he reached out to those in the medical community and community relating to mathematics, and they were able to develop a way in which all very statistics related to gather this data and to non-invasively to make a test for this, and they received FDA approval in 2000, about 11 years ago. It's something that something to this magnitude is relying upon a database like this and create a test in this fashion needed to be unbelievably accurate, and it took a lot of work. The database that they've collected is up to 42,000 patients now, from the ages of 14 to 95. 20% of those patients have normal coronary arteries. 80% of those have some level of coronary disease that has been cross-verified with angiography program and independently reviewed by 2 physicians. So it took a lot of time, a lot of capital to build this technology. And in the way in which it works, to answer the second question, it's what we're doing here is we're taking in this 7-minute test, we're taking 5 82-second measurements of the patient, primarily from 5 to we're taking it from the 4 extremities, wrists and ankles. C5, we're taking it, up on the left rib cage. And what we're doing is we're taking a systems analysis approach. We're looking at the differentials of Lagrange and Euler, which mathematically modeled the heart and the myocardium, the heart muscle. And between each of their models, Lagrange modeled the heart and Euler blood flow. We were able to bring those together mathematically into a multifunctional model, and we were able to look at the differentials based on our tests, certain patterns and indications, or indicators rather, and the patient data that was showing some strain for oxygen in the blood in the heart. We were able to collect those measurements and measurably give a score for that patient, like I said, against that 42,000 patient database, where we were comparing the patient's data that we collected in the office setting against that empirical database known disease burden. And to get into a little bit more of the function of it, what it's doing is once it collects that data from that patient, it's breaking it down into a wave, and it's plotting out that patient's specific, to that patient. We're converting that data from time domain, which is how we measure an EKG, into a frequency. We apply 6 mathematical transformations, 6 mathematical models against that data, to 166 indices of data based on each patient, which cluster based on that patient's condition, and then we use correlative analysis to plot that and to compare it against our database.
All right, now you got to stop and back up. You've just laid a whole bunch of big terms on us, and we have to slow down just a bit.
Sure.
Let's see if we can take this point by point, because I really think it is the true beauty. Once you understand this and clear up the mumbo jumbo, then you can begin to see how the picture emerges that allows for a device to do what this device claims it can do. So a while back, this Chinese guy, did you say a barefoot doctor? He was barefoot?
He was. He actually.
Oh, geez, give me a break. You got to cut it out with this imagery, okay? All right. So the guy was barefoot, but he had a math book and a calculator. I don't know. Anyway.
Yep. He was a barefoot doctor in China, and then when he went to school, and he traveled to the United States, medical school, and very intelligent guy, very, very intelligent. Still
alive, still around. Did you ever meet him?
Yeah, absolutely. Dr. Shen, he's still a practicing cardiologist at a very big practice.
Oh, great. I'm going to have to try to get this barefoot guy. Oh, he's wearing shoes now, I take it, right?
I hope so.
Yeah, okay. So he comes up with the concept, the electronics that can be able to pick up these changes through to the use of the passing of energy through the body, and sets up the ability to then collect data, which I think the next part of this is so beautiful is when you mentioned a database of 41,000 people, the information that we take off of any patient, we end up sending to be compared to that database. And that database is interesting, in my opinion, for one reason. Every single member of that 41,000 person database had 2 things done. 1, they had your study done, and 2, they actually did have a cardiac catheterization done. Right. Explain that point, because I think that allows the listener to appreciate that's how it is that this device can measure so accurately the status of coronary arteries, because everybody in your database that it gets compared to had coronary disease or some degree of it and had a catheterization that proved it, and now they can extrapolate out these measurements to be able to compare when somebody's severely afflicted, moderately afflicted, or so forth, how it could be that these mathematical equations could actually be determined and correlate to actual diseased people.
Sure. So you make a great point. The true accuracy lies in that we've collected this empirical database of now it's 42,000 patients, like you said, with a broad range of conditions across all ages, genders, sex, and so forth. And they've had, the patients with coronary disease have all had an angiogram or angiography.
Which is a cath.
Which is a cath, exactly. So those patients, that happens to be the most accurate coronary disease. It happens to be one of the more invasive. It's so very expensive and
a lot of risk. A lot of risk associated with it.
Absolutely, lots of risk. So it is most accurate. So in a sense, when we take a patient in your office, Dr. Courtney, so if patients call and decide to schedule to have one of these tests performed on them, what we're able to do is collect their data and them being the variable in the equation, right? And then we send it off for analysis. We're comparing that patient's data from your office against 42,000 patients with a broad range of no detectable level of coronary disease to a very high level, and that have had our test performed and an angio, so or a heart cath. So what we've done is we're able to correlate two of those together to look for, okay, in a patient that is moderately included, this is what their NCG should look like against an angiogram. A patient that is very highly included, has a high degree of cardiac blockage in their coronary arteries, this is what their results look like on a multifunction cardiogram test. So we're able to, using the patient in the office as the variable against the patient database of 42,000 patients, we are able to, with a degree of certainty, like you had indicated, of 91% against angiography or cardiac cath, report back to that patient their risk for coronary disease or their current level of coronary disease. Even if, like we had talked about, if they're asymptomatic or if they feel fine, they maybe they're not on any medication, maybe they are maybe they're in their 30s or 40s, maybe they're a younger patient, but we can tell them to a degree if they're at risk, if they're at high risk or moderate risk, and then we are able to, in the office, try to, especially if they're not at high risk, put them on a treatment plan to correct that, so that we can prevent the progression of that coronary disease. We can help prevent a cardiac event like a heart attack if they were at high risk or if they have family and so forth, through non-invasive treatments, diet, exercise, there's certain supplements, and I know you have the ECT bed, which is a phenomenal way to correct some coronary disease. So there's different treatments available to them. If we can catch it early enough, we're able to, which is the most important piece, we're able to use the multifunction cardiogram with the MCT test up to 4 times per year to track their progression of disease. So someone like myself, I'm a 0. If I test myself in 3 months, I'm hoping to also be. But for the patients that are maybe a 2 or a 3 or a 4 on our test, because remember, we're getting a result between 0 and 20, 20 being extremely high indication for coronary disease, and 0 being no detectable level of coronary disease. We're able to track on that scale for that patient where they currently stand with regards to coronary artery disease.
Are you, okay. I don't want to get ahead of myself. A couple more things to bring it to the point where I want you to talk about the test per se. I have said since I've been introduced to you, and now I ask you to scrutinize what I've been saying. I say with respect to your test that this is like getting the results of having a cardiac catheterization without having the cardiac catheterization.
Exactly.
So that is right. That is a 100% accurate statement. If you ever want to have information, and I think the last thing in the world anybody would ever want to have is a cardiac cath. There's nobody I know that's hanging around and say, geez, let me schedule myself for a cath so we can find out what's going on here. I mean, it's dreaded like the plague, when in fact, to know the information that could be obtained by one could be life-sparing. The fear of having something go wrong during the doggone study is enough to cause you to run away from it instead of embrace it, whereas without any of that going on here, this should be something you should be embracing rather easy. So I'm right.
If I were a patient, I would want to know my weight, my cholesterol, my blood pressure, my MCG score. Those are always things that I would want to know and be monitoring because those are really the items there that determine our overall health, right?
All right. So yeah, I'm with you on that.
So absolutely. I mean, the MCG is something that and for the offices in Pittsburgh that utilize this, their patients know their score. They know what they come into the office. And I've seen, I'll test a patient, say 3 to 6 months ago. They'll come back in. I recently had a patient at Dr. DeLeo's in Brownsville, PA, where the patient was a 1.5 on our test. They 3 or 4 months ago, they came in. They reported higher symptoms. They were more symptomatic. They had increased chest pain, increased dizziness, short of breath. They had none of that before. And we retested them. They went from a 1.5 to 2.5. They went up 1 full point on our test. And the doctor, along with the patient, was able to say, okay, I'm feeling more symptoms. My MCG score has gone up 1 full point in the course of 3 to 4 months. Let's make some medication adjustments. And so I know Dr. DeLeo at Fay West Medical in Brownsville did that. And as far as I know, the patient is feeling much better. So that's where the MCG can be greatly beneficial. Now, when the patient had their MCG originally, remember, they didn't have any symptoms. They were feeling fine. Nothing really major was underlying there. But because we had an MCG score on them previously, we were able to help assess them when they came back to the office with complications. So that's where this test really stands valuable for patients out there in either their primary care offices or their cardiology offices or other places where this truly has the value. So like you said, this is one of those things that every patient out there should be familiar with, that they should know their score and they should be monitoring.
Back to scores. When I worked in the realm of caths, the scores were percentages of occlusion. So a common result from a cath is the left main is 40% occluded, the LAD is 70% occluded, the RCA is 80% occluded. That's the report. Now, your score correlates with that, but you don't have an occlusion score. You have a digital score. Give me the idea of those scores once again. Somewhere between 0 and 20, you say?
Absolutely. And I want to clarify here. The highest score I've ever seen was 12. So typically we don't see scores any higher than 12 or even 15. I have never, any of those scores I typically don't see. So really, it's a range that I've seen in all my use of about 0 to 12. But those higher numbers are out there, especially for a patient that has very, very serious coronary disease. But in my experience, you're right. There is no ability to say 5 on this patient equals 40% blockage in the left coronary, left main coronary. So what we're able to do with this, though, is we're able to give that patient a score from 0 to 20. But the one major thing we're not able to do, obviously, is determine where that blockage is. We can't pinpoint what vessel it's in, we're not able to do that. But we are able to detect if they are at high risk and they are very
and do have blockage.
Then we can schedule a follow-up test for something that they would need, rather than going right to that.
Okay.
So a lot of patients that at least have experience with coronary disease already from a prior event or whatnot. They're probably very familiar with like stress tests we had talked about, where we use cardiolite or other means to test that patient, and that has the ability to detect coronary disease with very similar way to the MCG, but it's able to pinpoint where that disease is. However, as you and I know, a stress test is not something you want to have done on every patient either. There's a lot of risk factors there, and it's not a very pleasant test.
It's not a pleasant test for those folks. And just once again, even though this test may not be able to say exactly what artery, as the cath would do, what artery the occlusion exists in, it does correlate with high specificity the fact that you have occlusions at all.
Oh, absolutely. I mean, and I go over this with physicians regularly. In most tests, like stress tests, we either view the result as normal or abnormal, negative or positive. With this test, it's a sliding scale. So, and for good reason, we are trying to detect that early coronary disease, early development of coronary disease, which is probably the majority of your listeners, because we all have some level of plaque. None of our arteries are going to be completely clean. So there's some level of plaque in our arteries. So, we're able to detect that very early coronary disease and then the progression of that. So likewise, if you have a very high score on our test, then you can get a stress test scheduled or something else scheduled if other treatment options have been exhausted, to know, okay, I had 80% blockage in the left coronary. Now, there's really no need to know that unless you have a very high score on our test. Why would you necessarily need to know how blocked you were, unless we were going to do something about that? So, on our test, we're able to tell, like I said, with a 91 degree of sensitivity, that you do have, that something exists. And if something does exist, then we can further explore that. So that's really the purpose of the MCT, is as a frontline tool for coronary disease. And then also for those patients that have coronary disease and that have maybe had stress tests or other things in the past, we can use this up to 4 times a year. So a lot of times this can prolong their need to have stress tests as often or other tests as often. And this can help us evaluate their score more frequently and try to work with them to either maintain that score or get that score slightly reduced.
All right. A couple things that maybe the listener wouldn't appreciate, but I certainly did when I first met you and heard the story of your device and the company and so on and so forth. And that was this, and I think just a moment to spend on it is worthwhile. This is insurance covered, as if you hadn't mentioned it already, is going to come out. And we doctors always ask, well, is this billable? Does this have a code to bill for it? And so on the first day I met you, you mentioned something that just grabbed me the moment I heard it. And what grabbed me was you said, oh yeah, it has its own code. The codes that we use aren't for any other test other than this. It has its own unique code. And I knew in a heartbeat that I was dealing with something very unique, because that doesn't happen. I'm telling you, as a doctor, I've looked at so many things going on for many years. To get your own code requires a lot of justification, a lot of research, a lot of presentation of papers, a lot of support, and then the clinical application has to be there in order to have you get your own code. Talk to me a moment about that.
Yeah, I mean, that's huge, and every doctor that I meet with has a very similar response. This isn't like any other technology out there that's new, and maybe it sounds kind of hokey, or maybe it's too good to be true. This doesn't fall into that category at all. We've been published. We have 4 clinical trials studied all across the globe on this, New York, Germany to Asia, 4 FDA supervised clinical trials, double-blind. We've been published in many peer-reviewed journals, including Circulation, Chest, Sciences. We have a new one coming out that we just performed at Ohio Valley Hospital. Not sure which publication that one's going to come out of, but this has been very well reviewed and scrutinized, and it's been over the development of, like I said, over 20 years. We received our FDA approval back in 2000, so that's 11 years ago. So you can imagine how far we've come just from the approval of the device. And then, like you had indicated, we went to the AMA, American Medical Association. We applied for our own code, which, like you said,
that is ridiculous. It's hard to get.
I mean, that's one of the hardest things to get for a technology, and they have to really buy into the value because they're almost putting their stamp on it. They give you your own code, your own billable code, for the insurance companies to just recognize your technology. They're in a sense, putting, some degree their stamp of approval, just like the FDA would when they approve your device. So the next step after FDA approval is an AMA CPT code, which is what we have. We have our own C code that's reimbursable by we have Medicare reimbursement, and we also have most of the major private insurance companies, Bosses, Cigna, Health America, and others. So we're recognized, by multiple authorities, reimbursers. So the only way to really get that to happen for those that aren't very familiar with medical devices, drugs, therapies, and so forth, is to have a very well-supported technology, and that we have.
You sure do. All right, so why don't you take a moment? The clock is passing here. You were in my office the other day. You're coming back, by the way, on the 24th. Out there, if you're listening, if this is intriguing to you, give us a call. Schedule yourself to come on in and have this particular test done. Jerry's coming in the office on the 24th, right, Jerry?
Absolutely.
724-942-3002 will get you an opportunity to sign up for one of these open slots. Describe for our listener the test. Who should have the test? How long does it take? How does it perform? Anything that goes on during the test that they think they ought to know about. It's just about when you look at it being done, it's about as innocuous a test as I've ever seen. What's going on in there, Jer?
Well, to answer your question, it's a 7-minute test. Now, obviously the patient has to take their shoes and socks off when we place leads on their on their ankles. So it takes maybe 10 minutes if you from start to finish, depending on the scheduling and so forth. Now I know when we were at your office back on the 2nd, we did approximately 13 tests. We tested all age ranges and all genders and all degrees of conditions, from very low, patients that felt fine, that weren't really experiencing many symptoms at all, maybe had some family history or just a concern for what their MCT score was, and other patients that have had stents or bypass surgery. So we had all range of patients. We had all range of scores. Some of our higher scores were, I know when we reviewed the scores, Dr. Courtney, you were surprised with a few of them. So that happens, and that's why it's very important to test patients, to test patients. And patients really need to be compliant with coming in to have this test and to have it done at least every 6 months, 1 year to 6 months, depending on your recommendation, because you can always be thrown a curveball. So the test is it's a 7-minute test. It's resting. They lay down. They keep all their clothes on. We just have them remove their watch if they have a watch. They relax. I take the test. Again, I'm taking 5 82-second measurements, so it's about 7 minutes or so. And then that's it. The patient leaves, and then we review the score with them, either on their next visit or if you would like to call them, Dr. Fort, and schedule them for a visit or however we handle that. Now, for patients that would come in complaining of chest pain, we are able to get their test that day if there's a special circumstance. But other than that, it's very painless.
It certainly is. 7.5 minutes later, completely innocuous. I've never seen anything, even an EKG, because you got to disrobe literally for an EKG. An EKG is more invasive than this is, and the results here are so much more revealing than an EKG ever has been. They're each used for their own, in their own way, for their own reason.
Right. I mean, an EKG is very accurate for arrhythmia. There's no doubt about it. But relating to coronary disease, an EKG is really only about 20% sensitive, which is 20% very low compared to our 91% for coronary artery disease. Now, like you said, EKG has a lot of good uses for arrhythmias and so forth. But for coronary disease, there's nothing out there like the MCG, and I encourage all your listeners to get one scheduled and to ask their physicians about the MCG. We have several MCGs out there. Dr. DeLeo in Brownsville, yourself in Murray, Dr. Flores in Singleton, AGH, Dr. Haggerty has one at AGH, and also Clarion, and I believe there's a physician at McDonald that's looking into getting one as well. So the machines are out there, and for the patients that want more information about this or want to know where their closest physician is, they can always email me. If you put my email up on your website, Dr. Courtney, it's JERE.Singleton at prologicmedical.com, PROLOGICMEDICAL.com.
All right, now look, Jerry, we got bongos in the background, which signifies our time out of here. I think we did an excellent show today, first bringing the entire message about MCG. And then you're going to be back with us next week. Hopefully, we talk a little more about scoring and the applicability of the pathology to those scores. All two, in the meantime, getting ready for those of you who give us a call, 724-942-3002. MCG testing in our office on the 24th. Jerry, you're back next week, right, on the 18th?
Absolutely. Next Friday morning, right, Dr. Courtney?
Absolutely.
Looking forward to it.
There you have it, folks. Hope you have a great weekend. It's time to get on out of here. This is Dr. Dennis Courtney with Mr. Jerry Singleton saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania.